Okay, so this is chapter 24, pathogenic DNA viruses. We're starting with the herpes virus. There's a certain number of ways to distinguish between the different strains. One that has to do with the type of genetic material that it has. Some of the viruses have a double-stranded DNA. Some of them have single-stranded DNA. And HepaDNA viridae, they can contain both single and double-stranded DNA. So that's a peculiarity of them. They may have an envelope. Okay, so you have the virus with the genetic material inside of it, which of course is DNA. That DNA is surrounded by a protein capsid, typically icosahedral, and then that protein capsid may be covered by an envelope. That envelope is typically made out of the plasma membrane of the host that the virus infects, and the role of that envelope is to allow the virus to circumvent the innate and adaptive immune response of the host. Finally, the size of the virus matters, and also the affinity that it has for different tissues. So different viruses have different attachment proteins for different tissues. So we're talking about herpes viridae because, well, it is the most prevalent DNA virus out there. Okay, so it's important to address it. Herpes virus, human herpes virus 1 and 2, HHV1 and 2. It used to be known as herpes simplex. Okay, if you remember, I don't know if you guys had the STD movie in high school, but this is one of the sexually transmitted diseases that they used to talk about is herpes simplex. And one of the things that's significant about HHV1 and 2 is that the virus, it can be reconciled by the body. Okay, it can be destroyed by the body, but it can still remain latent in suspended animation, if you will, inside the ganglia or the nerves of the body. Okay, this is important because the manifestation of the different manifestations of HHV1 and 2 depends on which nerves in the body it has remained dormant in. So, for example, if it's in the ocular nerve, the ophthalmic branch, then ocular herpes will manifest. If it's in the mandibular branch, then you'll have the so-called fever blisters. If it's in the maxillary branch, then you have the so-called cold sores. If it's in the brachial nerves, then you'll have what's called a whitlow, and so on and so forth. So this is why the manifestation of these herpes always takes place in the same area in the body. Okay, because the body's adaptive immune response resolves the infection outside the nerve, but the virus resides latently inside the nerve. And then when you're stressed, it becomes lysogenic, and it comes out and it manifests at the end branch of that nerve, coming out at the exact same place in your body. Okay. So HHV1 and 2 have a set of manifestations: oral, genital, ocular, the whitlow, and unfortunately, with infants, neonatal herpes. So starting with oral herpes, okay, this is the fever blisters or cold sores that we associate with the face. Okay, it can also be in the mouth, in gingivostomatis, okay, or it can be in the pharynx. So it depends on again which nerve this HHV1 and 2 has associated itself with. And this is what a lesion of it looks like. Okay, and I gotta tell you, one of the concerns that I have is that when somebody is manifesting one of these cold sores, or fever blisters, that HHV1 and 2 is proactively being shed. Okay, so it can actually be transferred from one person to another. And so occasionally I'm concerned when I go to, service providers, or I go to a food provider, and they have an open sore on their face, because that open sore means that person is, well, pretty much disseminating HHV1 and or 2. Okay, so that's what oral herpes looks like. Moving on to genital herpes. Okay, same concept, painful lesion developing in the genital area. And the interesting thing is that HHV1 can manifest itself both orally and genitally. And so it is possible to transfer the infection from one place to the other through oral sex. Okay, so this is something that people are not aware of. They seem to be under the belief that, hey, once I have it, nothing else can go wrong. No, that's actually not true. It is actually possible to reinfect yourself in additional areas in the body. So that's something that needs to be addressed with hygiene and care. So genital herpes, here's the author's example of genital herpes. Okay, and then we go from that to ocular, through the ocular nerve. Okay, when it manifests, there's a gritty feeling in the eye. There's conjunctivitis, pain, sensitivity to light, and effectively that inflammation in the eyelid can lead to corneal lesions. Okay, so what does this mean? This means that if it's not managed, the person could possibly lose some sight. Okay, and there's a manifestation of ocular herpes. And then we have the whitlow. The whitlow is herpes typically in the hands. Okay, so there's a whitlow. Okay, and this is something that again is very, very contagious. And then finally, neonatal herpes, and this is a significant problem, because if HHV1 or 2 is passed to an infant, that infant does not have a well-developed immune system. So the problems can be significant, and there can actually be mortality associated with it. If somebody is immunocompromised, what are we talking about? We're talking about the very young, the very old, the very sick, the transplant patients, those that have retroviral infections already. Those are the immunosuppressed. With those people, HHV1 and 2 can also cause encephalitis, meningitis, and pneumonia. Okay, so these are non-typical pathologies associated with a wide berth that HHV and 2 obtain in these individuals. Okay, so what do we know about treatment? They can be controlled. Okay, if you with control, you can reduce the period of the lesion, and consequently the viral shedding. In other words, minimize the possibility of viral infection. Okay, but these events do not cure the disease or get rid of the latent virus that resides in the nerve. So this is pretty much a problem that individual is going to be dealing with for probably the rest of their lives. Switching over to HHV3, okay, the varicella zoster virus. It causes varicella, otherwise known as chickenpox in children, and shingles in adults. Same virus, 2 different manifestations depending on the age of the individual. And one of the things that I was used to read is that the characteristic lesions in chickenpox appear 2 to 3 weeks after infection. And I find that amusing because when I was a medic in the service, I was taking the vitals from a young soldier, and she had chickenpox. She was admitted, and I was admitted about two or 3 days later with characteristic skin lesions. So I think they're a little bit off on this one. I think that these lesions can appear in 2 to 3 days and cause a lot of problem. Although, as the author says, in adults this problem is more severe. In men, it can lead to sterilization. Let's see. The latent virus can reactivate in the elderly, and in regions where the nerve runs along the body, called a dermatome. Okay. And when this happens, that is called shingles. So here's chickenpox. Okay. Here's a dermatome. Okay. So the latent virus resides inside the nerve, and then when it travels down the nerve, it manifests wherever those nerve endings reside in the body, and that area is called a dermatome. So you can see that it follows the region of the nerve ending. Okay. So this is a shingles rash caused, okay, by HHV, and you have to be careful because you're going to be asked about rashes in the assessment. And with shingles, the rash is very specific. It's going to be in a very special place, such as here. It is not throughout the chest and body like in other infections. In shingles, it is in a very specific part of the body every time. Okay, usually self-limiting. What does this mean? This means that the shingles is going to manifest, the adaptive immune system is going to be launched, is going to be, the infection is going to be reconciled, and then it's going to remain latent inside the nerve to manifest at a later date. So again, we're back to management of symptoms, and pretty much the standard with HHV. Now we're moving to HHV4, the Epstein-Barr virus. Okay, and this is interesting. The manifestations of this herpes virus is very broad, and it seems to depend on the age and the development of the immune system of the individual. Okay, so it can go from the trivial to the extreme. So certain diseases that are caused by HHV4 is Hodgkin's lymphoma, which is cancer, chronic fatigue syndrome, and oral hairy leukoplakia. And leukoplakia is effectively the precipitation of iron-like compounds on the tongue that gives the tongue a dark look, a dark, hairy look to it. So here's the spectrum, okay? And notice that it has to do with the cell immunity, okay? So here we have the absence of cellular immunity to the vigorous, okay? If cell immunity is lacking, then the individual would develop the oral hairy leukoplakia. If the cell immunity, what are we talking about? We're talking about cytotoxic T cells. If it's poor, then the manifestations can be many. It could be Burkitt's lymphoma, which is a cancer, nasopharyngeal cancer, chronic fatigue syndrome, or Hodgkin's lymphoma. These are serious problems. If the cellular immunity is normal, the individual might end up with absolutely no symptoms whatsoever. And then finally, if it's vigorous, you end up with the so-called mononucleosis, which everybody refers to in high school as the so-called kissing disease. So now you notice that this is not a trivial problem, okay? HHV4 is can be very problematic, and if you end up with mononucleosis in high school, consider yourself lucky, because the other manifestations could be cancer or leukoplakia, which is, again, precipitation of minerals in the tongue, which demonstrates a significant pathology. Okay. Something that's interesting about HHV4 is that it invades the B lymphocytes. Okay. Remember, we have two lymphocytes in the blood. We have B and T. T are cytotoxic T cells, and B are the humoral or antibody producing lymphocytes. So in these lymphocytes, this HHV3 can become latent, and when it becomes awakened, lysogenic, it carries out apoptosis, cell suicide of these B cells. So that means that the lymphatic system, the humoral system of the adaptive immune response suffers under this particular virus. Okay. Let's keep on going here. Burkitt's lymphoma functions well with chemotherapy. Mononucleosis patients, you pretty much manage the symptoms and allow the adaptive immune response to carry its course. Okay, HHV6. We have the rocellovirus, which causes rosella in infants. This is characterized by a pink rash, face, neck, trunk, and thighs. So this is the entire body of the infant, as opposed to shingles, where shingles is localized. So I'm accenting this because your assessment talks about rashes. You have to be able to distinguish between a rash that's created by HHV6, which is systematic, and a localized rash created by shingles. Okay. HHV8 retinosarcoma is responsible for Kaposi sarcoma. That's important to know. Why? Kaposi sarcoma is a relatively rare cancer. It is typically indicative of people that are very immunocompromised, specifically HIV/AIDS patients. So there's rosella in an infant, and there's Kaposi sarcoma in an HIV/AIDS patient. Okay, now we're talking about hepatitis. So specifically hepatitis B, and again, the reason for this is because it's one of the most significant, is the most significant virus, okay? Is the one causes hepatitis, which is inflammation of the liver. And notice, HPV is the only DNA virus that causes hepatitis, okay? So that's why we're focusing on HPV. How do we know that hepatitis is taking place? Because liver failure gives very specific symptoms, specifically jaundice, enlargement of the liver, abdominal pain, bleeding, and this jaundice, it's a yellowing of the skin. It is very prevalent in the whites of the eyes. With some people, you can literally see that the eyes are very yellow. That's jaundice. That's indicative of liver failure. Okay. What else should you know? You should know that if somebody has hepatitis B and they end up lucky enough to become infected with hepatitis D as well, it increases the incidence of liver damage and the incidence of liver cancer. That's, I think the author just put a filter on this. The whole person looks yellow, but you know what? Close enough. That's actually pretty yellow. And essentially what's happening is that with a liver failure, the bilirubin from the erythrocytes that are being eliminated by the body is not being processed by the liver in the spleen, is not being eliminated in the stool, and it accumulates in the tissues of the body. And bilirubin has a characteristic yellow color to it, and you end up with this jaundice. This is very extreme, very extreme. Okay, I do not believe that this is true. If memory serves right, it is my understanding that they have come up with a vaccination for hepatitis B that actually does in fact treat hepatitis B. As a fact, I believe there's even commercials to that effect. So this has changed. There's actually treatment for this, and there's also vaccinations for protection against hepatitis B. So that's a beautiful thing that's taken place lately. And that is it for this chapter. I hope it wasn't too long or too boring for you. Thank you for your attention, and we'll see you guys pretty soon.